Today, we're diving into a hot topic that affects many of us: medications that can lead to addiction. It's a serious issue, and being informed is the first step to staying safe. So, here's a rundown of the top 10 medications notorious for their addictive potential in the US. What causes addiction? Addiction's a tricky beast, you know. It's not just about popping a pill and suddenly you're hooked. There's more to it. It's like these meds mess around with our brains in a way that makes them go, hey, I kinda need this stuff now. It's all about these medications mess with our brain chemistry, like opioids tinkering with the pleasure and pain signals, or benzos slowing down our nervous system. Over time, our bodies get used to these changes and start craving more just to feel normal. That's when the addiction dance begins. So it's not just about the meds themselves, but how they twist up our brain's wiring, making us want more and more. Let's take a look at medications that can cause addiction. Number 10. Opioids. These painkillers are often prescribed after surgeries or for chronic pain. They're effective, but their addictive nature is a huge concern. A clinical study found that extended use can lead to dependence even when taken as prescribed. Common opioids include oxycodone, hydrocodone, and morphine. Number 9. Benzodiazepines. These meds are used to treat anxiety, insomnia, and seizures. The reason they're added to this list? They work by slowing down the nervous system, and over time, the body can develop a tolerance, leading to dependency. Clinical studies show that long-term use can cause addiction. Popular benzodiazepines are Xanax, Valium, and Ativan. Number 8. Stimulants. Medications like Adderall and Ritalin, prescribed for ADHD and narcolepsy, can also be addictive. They boost dopamine levels in the brain, but prolonged use can lead to tolerance and addiction. A study published in the Journal of Clinical Psychiatry highlighted the potential for abuse, especially among young adults. Number 7. Barbiturates. These used to be common for treating anxiety, insomnia, and seizures. But due to their high addiction potential and risk of overdose, they're not as widely prescribed anymore. Research emphasized the dangers of dependency and the need for cautious use. Number 6. Sleep medications. Z-drugs like Ambien and Lunesta are used to treat insomnia. They're effective, but they can also be habit-forming. Clinical trials have shown that dependency can develop, especially with prolonged use beyond the recommended duration. Number 5. Muscle relaxants. Prescribed for muscle spasms or pain. Drugs like Soma and Flexeril work by depressing the central nervous system. However, they can be addictive. Studies have demonstrated the risks associated with long-term use, emphasizing the need for limited dosage and duration. Should you have any inquiries regarding your medication, we've crafted a dedicated book for your benefit. 10 questions everyone should ask their pharmacist. You can find the link in the description below. Feel free to explore it. Number 4. Antidepressants. While not inherently addictive, certain medications, especially SSRIs like Prozac and Zoloft, can cause dependence in some individuals. They're not as addictive as other medications on the list, but sudden discontinuation can lead to withdrawal symptoms. Research shed light on the importance of gradual tapering when stopping these medications. Number 3. Antipsychotics. Medications like Risperdal and Abilify, used to treat conditions like schizophrenia and bipolar disorder, aren't typically addictive. However, some individuals may develop a dependency as observed in studies conducted. Number 2. ADHD medications. Non-stimulants. Drugs like Strattera are used for ADHD without the stimulant effects. While they're less likely to be addictive compared to stimulants, studies have shown that dependency can still occur, particularly with misuse or abuse. Number 1. Cough syrups with codeine. Often used to treat coughs, these syrups contain codeine, which can be addictive. Studies have demonstrated the risk associated with prolonged use beyond what's prescribed. When it comes to medications with addictive potential, understanding the recommended dosage is crucial. For most adults, dosages are tailored based on individual needs and medical conditions. Always follow your doctor's prescribed amount and frequency, as deviation can increase the risk of addiction and side effects. Using these medications as directed is essential. They're typically taken orally with or without food, as advised by your healthcare provider. Dosing intervals vary among medications, ranging from once a day to multiple times daily. It's vital to adhere strictly to the prescribed schedule to avoid complications. Side effects can vary widely among these medications. For opioids, side effects may include constipation, drowsiness, and nausea. Benzodiazepines might cause dizziness, drowsiness, and memory issues. Stimulants can lead to insomnia, loss of appetite, and increased heart rate. Each medication has its own set of potential side effects, so it's crucial to be aware and consult your doctor if you notice any unusual symptoms. Remember, these medications serve important medical purposes, but they also pose risk if not used correctly. Always communicate openly with your healthcare provider regarding any concerns or experiences you have while taking these medications. Being informed and vigilant is key to using them safely and avoiding the pitfalls of addiction. Stay safe, stay informed. Welcome to Dr. Vivian Medications and Natural Supplements. Our channel is committed to delivering valuable health and wellness insights crafted by a certified expert. In these challenging times, staying well-informed about self-care is of utmost importance. If you find our content helpful, please support us by giving this video a thumbs up. Your feedback lets us know how we're doing. If you'd like to see more of such content, consider subscribing and activating the notification bell to stay updated on our future videos. Thank you for tuning in.